You arrive to find a 37-year-old female who reports eating cookies she purchased at a bake sale. She has audible wheezing and a scratching red, blotchy areas on her abdomen, chest, and arms.
Okay. So 37-year-old female, blotchy skin. Okay. So I'll begin. PPE with my shorts. Scene is safe, and I see nature of illness is reported, respiratory distress, blotches of skin, possible allergic reaction after going to that bake sale. I see one patient, probably call for ALS because of she is having trouble breathing, and as of now no trauma is reported, so I'll probably not need to consider spinal stabilization as of now. So I'll hold that for later possibly. As I approach the patient, general impression, unstable, difficulty breathing, level of consciousness. Hello ma'am, what seems to be bothering you?
I'm having an allergic reaction to those cookies I ate.
Okay, so patient is alert and conscious with that response on the AVPU scale. She is A, and chief complaint is she thinks she's having an allergic reaction due to the cookies. So with that, I will then be able to, seeing that she's having difficulty breathing, I can check with a pulse oximeter for breathing, for oxygen saturation. Also possibly check capillary refill. With the nail polish she's having, I'd probably have to press on the side of the nail beds to test. And then her condition is that I see blotches on the skin, possible urticaria, and telltale signs of allergic reaction. So that I will administer a non-rebreather mask at 15 liters per minute of oxygen, so we'll have that on. And then with that, I'll proceed into the questions. So, ma'am, when did this attack start?
It was after I ate the cookies.
Okay, so after you ate the cookies, is there any activity or anything you've done that's made it worse or better?
I'm allergic to peanuts, and I ate the cookies about 20 minutes ago, and I began itching all over 5 minutes later. And I only ate 2 cookies.
Okay, so in the last 5 minutes it's developed worse?
I'm having trouble breathing. I feel lightheaded and dizzy.
Okay, so yeah, so nothing then provokes it with what you've been doing? Any position helping you breathe? No?
No.
Okay.
My wheezing is worse. Now I'm sweating really bad.
Sweating bad. So how do you describe your condition? Any pain in the chest or anywhere?
No, just itchy.
Okay. Just extremely itchy. Okay. It's okay, we'll get you good care. So with the next question of severity, radiations, and then have you felt itchiness all over your body, or is it localized anywhere?
It's mainly in the abdomen and arms. And
okay, abdomen and arms, very telltale for a stomach, and then it's spreading to respiratory system. So, and then, ma'am, on a scale of 1 to 10, how do you rate the itchiness or pain you're experiencing?
Probably about a 7.
7? Okay, so pretty severe. And then, I guess, has there been any changes with your condition in the last 5 minutes or so? Or has it only gotten progressively worse?
It just seems to be getting worse.
Just worse. Okay, so at this time, yeah, definitely have ALS called high priority transport with her breathing condition, appearing closer cyanotic probably, but the blotchiness of skin, severe reaction. So this time I proceed to sample questions. Ma'am, so you said you ate 2 cookies at the bake sale. You think you're having an allergic reaction. Is there anything in the cookies you might be allergic to? What are you allergic to?
Peanuts. I'm allergic to penicillin.
Penicillin?
Penicillin's not the cookies, but...
Have you taken any antibiotics recently? Any bacterial infections?
No.
No?
None.
Okay. So no penicillin you've come in contact with?
None.
Okay. So for allergies, that leads me back to the allergic reaction with the peanuts, probably in those cookies. So with that, I'll move on to medications. So you said no antibiotics. Any other medications you're taking?
None.
None. Okay. So I can rule out other medications. No heart problems. anything of that nature that she's been diagnosed with. And then for past history,
I had to spend 2 days in the hospital the last time this happened to me.
okay, so you have had a reaction like this. Would you say it's similar to that or worse?
Pretty similar.
Pretty similar, okay. It's okay, man, we'll get you good care soon. So with that, have you eaten anything besides the cookies?
The last thing I ate were those cookies.
Last thing you ate was the cookies, okay. And have you drank anything out of the ordinary?
No.
No? Okay. And then the events surrounding this, so besides attending that bake sale, was that the onset of it, and what events you were doing when it started?
Yes.
Yeah.
It was those cookies. After those cookies.
Okay. And so you weren't actively exercising at the time or anything out of your ordinary routine?
No.
Okay.
No.
So yeah, at this time I'm definitely leaning towards an allergic reaction. I will take full vitals just to get a final picture. So
Okay.
I will test her pulse, ma'am, and I will check your pulse now. You don't have to remove. Okay, I'll check the radial pulse because she's conscious. Making sure not to use my thumb because it obstructs. Ma'am, if you could put your arm across your chest for me, and then I can test the pulse for 30 seconds textbook, real life only 15. So I'll test it here. Feel free to breathe normally for me. Don't breathe too deep, just breathe normal. I'll reset that for 15 seconds. And 15, okay. Patient reports times 4, so for the 15, so about 72 beats per minute, and respiratory rate of about 18. At this time, you can tell me what the actual value is.
26.
26 breaths. Okay.
And
So respiratory rate is higher than normal. And then for heart rate, if it says
120 for pulse.
120 for pulse. Okay, so tachycardia and tachypnea. It definitely telltale signs of an allergic reaction again. Ma'am, can I get your blood pressure?
Yes.
Okay, so test blood pressure on the upper arm, making sure the arrows face the brachial artery here. I would squeeze up to 200 millimeters of mercury and let go for the first pulse sound and then the second pulse sound. Systolic blood pressure is
90/60.
so 90 systolic. We're at the bottom of the normal standard 90 to 140. So slight, almost hypotensive. And so again, that could be vasodilation from the allergic reaction. So definitely epinephrine is something good for vasoconstrictor in this situation. So, ma'am, do you have any epinephrine, EpiPen, or injector?
I can't remember if I have it in my purse or not.
It might also say on the back page if you have.
I have my EpiPen upstairs, but I'm afraid to stick myself.
Okay, so patient does have an EpiPen. Definitely want to get treated quickly. I guess I should mention focus assessment. Now that I've pretty much determined with my field impression that is anaphylaxis the patient's going through, I can move on to interventions. Depending if it's a standing order or not, I can either contact medical control to receive authorization to give an EpiPen, or else if it's standing orders to do so, I can assist the patient with their EpiPen. They reported that they're afraid to stick themselves, so I can either my partner or myself go retrieve the EpiPen upstairs. I'd ask the patient, ma'am, do you know where you put it upstairs?
Probably on my dresser.
Probably on dresser. Okay, so then we'd retrieve the EpiPen, say we get it, we bring it here. Ma'am, can you take your EpiPen? Perfect. So EpiPen functions with intramuscular, so I'd asked on the lateral femur area into the muscle here. It's okay, we'll do this on count of 3. 1, 2, 3. Yeah. Hold it in for I think 10 seconds, making sure it works and completely releases. all of epinephrine. After that time, we can then remove it, dispose of the EpiPen in a protective case, making sure not to jab anyone else with it. At that time, I would try to assess the patient for anything. I could ask, yeah, ma'am, are you feeling better? It can take, I think, something like 30 seconds to a minute to kick in.
A little bit better, yes.
A little bit better. I had to recheck vitals while we try to get in the ambulance, unless we're in the ambulance at this time because of the questions. So yeah, with the condition, could deteriorate quickly, so I'd assess every 5 minutes. So yeah, I would reassess vitals, and I would send an oral report to the hospital, making sure that the patient still has oxygen. So I could get the oral report. This is my EMS unit. We have a 37-year-old female here complaining of anaphylaxis and respiratory distress in general. Right now, her vitals were 90, systolic blood pressure. She had 26 or 28 respiratory rate.
60 over 90
Respiratory rate.
was, respiratory rate was 26.
26, yeah, 26 respiratory rate, and then 120 heart pulse rate. For medications, she was taking no prior medications, but we administered epinephrine and the oxygen at 15 liters per minute. She is responding slightly better to the treatment. Her condition is improving.
Yes.
And then no special considerations to think of. I could then do that. So yeah, every 5 minutes on the way to the hospital, I would reassess her condition. And yeah, I think I'm done with this assessment.